Welcome our friends from India. We start with the program. The topic of today is just update on the matrix concept from symptom to systemic medicine. And this is directly going to the paradigm shift what we have in medicine. We go from structure to process, and what is at the end the ingredient what we treat? What is behind? What is really a diagnosis? So first is, what is the matrix concept? I have to just make very clear in this week that the matrix rhythm therapy, the matrix mobile, is not just a device as we use it in normal physiotherapy, like ultrasound, like shockwave, like all these things. It is a little bit more, because we are directly trying to understand the language rhythms of the body. The language of the body, you know. What kind of rhythms does the body produce? Heart rhythm, brain rhythm, and so on. And as you know, it is a body intrinsic rhythm that we use for a treatment, and just because we saw when the body is playing a certain music like Mozart, we should not apply techno music. So it's a kind of synchronization, and this is different from other devices. And this is why we have no side effect. So the matrix concept is a holistic management concept for body and mind based on regulation of cellular units under the umbrella of spirituality. So this is the holistic concept. It's not only using a device on the body, because you are at the end, as Ines was just talking to us, you have to speak to the patients, you have to talk about the life context. So not just about the environment of the cells. So sick and healthy states are different parts of the same process. This is very important. Yes? Sick and healthy states are different parts from the same process. So it is not another category. And so it's principally reversible. Yes? You can just regulate by triggers. And the one who has the best trigger is the best doctor or the best person, you know. It can be a good friend, it could be a good hint from the coiffeur or whatever it is, you know. Just find the trigger and shift the process back to normal. We have to do good documentation to show, and because this is the only proof and this is the only way how such kind of treatments like the matrix mobile will be accepted in future time. And so it is so important what you are doing with pre and post documentation. This we have to bring more into a certain order that is more accepted from the scientific side where we can publish these things. And so I think slowly we can shift the system into the way we want to have it. Thank you so much.
So I am a Pilates and yoga teacher, and I actually consider myself a movement therapist because I don't want to associate myself to any particular movement modality. I like to think I teach you how to move and then you take it from there, if you're playing sports or if you're already doing some activities or if you just want to improve your posture and just being you as a human being. I use the matrix, what I'm trying to say, in many ways. It started with me teaching Pilates, but then I realized, okay, I can go a little bit further. I can help you how to move, I can help you to reduce pain. But then people have discovered that they also feel differently and they look differently with the matrix aesthetically. So it works from within, but it gives you also the results from the outside. And I'll give you another story. I'm doing the legs with the matrix for somebody for cellulite, and suddenly she also has varicose veins. And while I'm doing it, the varicose veins are disappearing. And I've got a picture between one leg and the other. And so I'm saying, wow. So I'm still very much in contact with those limbs. So every time I get a discover, I get excited, but I want to know, is that correct? or am I just going and I shouldn't be doing this? And so I send pictures and I send my feedback. Oh, I've just dealt with somebody with so-and-so. Is he okay? These are the pictures. And it's amazing. So they want to come further, because rather than have an operation for varicose veins, they actually quite like the fact that I can just go with the matrix and let them less visible. Thank you. Yeah, and please don't forget, we are humans, and the human race is meant to move. It's not meant to sit down. So the more you move, the better you will feel. We are not meant to sit down. I think most of the ailments of modern society are due to lack of movement.
Great. So now, how can we bring our mobility into form, or our emotion goes to motion, goes to contraction? All kinds of motions will end in a contraction. Either you are happy and you are jumping because you are happy, or if you are depressive, every motion or any emotion goes to motion and at the end in a contraction. That means, and it's interesting, that you see the emotion from someone not on his leg, you see it in the face. That means our face shows what we are looking like. That means the impression makes the expression. The whole body in different levels, in different planes. Heute ging es eigentlich im Wesentlichen um das Handling der ganzen, des Gerätes und des Fühlens. Und das hat aber dazu geführt, dass sozusagen das Handling so gut fortgeschritten ist, dass also hier bereits richtig therapiert wird in verschiedenen Positionen. Und ich bin also ganz begeistert, wie die Gruppe bereits in Fahrt gekommen ist, schon nach dem ersten Tag. Und ja, das hat mich auch beflügelt, schon für die ganze Woche, dass wir hier entsprechend weitermachen. Die Gruppe wird sich morgen wieder treffen um 7:30 für die Pilatesübungen, diesmal am Strand. Und dann geht es eben immer wieder erstmal frisch in den Tag nach Schwimmen. Und ja, jeder ist schon neugierig, was morgen kommt.
Randoll for their support and making this available here in Turkey and bringing us all together.
Sonra bana tavsiye edilen bu yöntemlerden bir tanesi olan frekans terapileri adına magnetoterapi yöntemini getirin bakalım bir deneyelim diyerek bu hastada uygulamaya başladı.
He then decided to use magnetotherapy with really half-heartedly or not really believing in it, and he just said, okay, well, if there's nothing to lose, let's try it. And this is how he decided to give a chance on this magnetotherapy at the time.
Magnetoterapi biliyorsunuz sonuçta matrix ritim terapinin temelinde var olan 8-12 Hz'lik frekansın kullanılmasını sağlıyor farklı bir uygulama gibi.
It's something similar to matrix rhythm therapy, which works in a similar principle but a different method.
Ve bu yöntemi uygulamaya başladığım andan itibaren o çocuğun yarasının hızlı bir şekilde ve gözle görülür bir şekilde iyileştiğini gözlemledim.
And the wound healed very steadily, and I was really amazed to see the results.
Evet, matrix ritim terapisiyle hastalıkların tedavisinde yaptığımız çalışmaların ötesinde özellikle dünkü sunumuyla wellness alanında matrix ritim terapisi uygulamaları, matrix ritim terapisi uygulamaları ve bunların da Türkiye'deki yaygınlaşması adına bundan sonra daha geniş katılımlarla çok daha güzel çalışmalar yapacağımıza inanıyorum. Teşekkür ediyorum.
With this, I will leave you. Thank you. Any questions?
I learned many different techniques. The TCM helped me a lot. Buteiko from Russia helped me a lot. The great masters helped me a lot. My first mentor, Dr. Recep Koksat, taught me pathology psychology. It's very important. Have consequences over there. And come to Turkey. Met with Cesme first at EU, Cesme University, and then listened to Ulrich. He was already on the podium speaking about meditation therapy. I said, okay, what's this guy talking about? Makes sense, try it. And I tried meditation therapy, and later on I involved, got the machine. For the first time I used something that, a machine in my healing practices, and I'm glad I did. Now my arm is 10 feet longer. Thank you for that. A great effect because, as you know, as you all know, you can speed up the process, healing process. In the past, I will probably solve a back problem in 20-30 sessions. Now, in 2-3 sessions, people already feel much better, thanks to Dr. Randoll. And not only that, the whole concept of medicine is put in the right place. Everybody can enjoy from can learn from Dr. Randoll and his wonderful theory. Congratulations and applaud.
So I think probably a little bit of my background. I know Dr. Randoll said so, who I am, but I'm a medical doctor, actually trained here in Izmir, 9 Eylül University. Then I was trained as a clinical oncologist, then I moved to UK and I continued there as a clinical oncologist. I did a PhD, then I was treating patients till 2006, then I moved to clinical research, and since 2006 I'm doing cancer drug development and working in phase 1 to 3 studies and after registration studies. So a lot of research, a lot of translation of animal data to the clinic, a lot of clinical research with a lot of outcomes. So here we are. the situation is very clear, and I think now we have to ask the question as the matrix rhythm community here, what can we do? You know, what should we do? And I think I kind of tried to brainstorm myself, and I kind of looked at the list before, what can we do, and I came up with some ideas, and we are trying to generate the evidence. So we have two ways now. We can say, okay, you know what, let's not bother, because it's not going to be really critical to create this evidence, because we know it works for patients. For example, do I need a statistic to tell me for Andrew anything? No, he's 100%. He's there. He wasn't walking, he's walking. And you know, I don't need it. But what about to get the matrix rhythm therapy to where it should be? And maybe I'm very naive that I'm thinking maybe we should be doing something serious about it. I know this is an ambitious talk, maybe, yes. So I'm kind of coming with some ideas and a lot of work for us. But I think if we are really serious about it, we can do it. And when we know that extracellular matrix is actually driving force of the whole mammalian diseases, this was a recent paper, it was amazing, and these are all the things that are modulated by extracellular matrix. And look at these, all the details. You know, TGF-betas, IL-6, IL-15s, and integrins and all that. These are all measurable in blood, very simple. Before matrix, after matrix. We can even add translational research in there. You know, it's not rocket science. So anyway, with that, I think we can do a lot together. You know, we might be small in the biggest industries, but I think we have the power to come together and give matrix the chance that it deserves. I think that's all I'm going to say. And thank you.
My dear all Matrix Health partners, I thank the organizers, Matrix Rhythm Therapy Turkey, Dr. Mustafa and his team for organizing this event and giving this an opportunity for us to present our experience with Matrix Rhythm Therapy with you all. Thank you also for taking care of all our accommodation, and we feel very comfortable. Thank you so much, sir. It is my really pride to represent Matrix Rhythm Therapy in India, and this journey we started in August 2009. I say that thanks to again the Dr. Randoll for giving the equipment. You know, this is really the, as I mentioned, that he is teaching us the passion to do. And what this equipment can do, that we observed, and this is what kept us motivated always. Because unless you experience something, you do not feel like promoting. And I will like to show you here what we experienced, personally me, as a demonstration, because as I said, that Dr. Randoll says that shoot the goals. And you can see that this lady, she was in the pain, the physiotherapy. At 2 to 3 o'clock. In that session of the 4 hours, I achieved these movements. Same day. Same day, again 3 to 6. So this gave us then motivation to work, and work. The success stories. And then the physiotherapist was asking Anilji what this vibrator is doing. And now in India we have team of about 250 practitioners, and with the matrix rhythm therapy, with the help of Dr. Randoll, I think this is our duty, this is our duty towards the society, that we deliver to the people those what they want, the knowledge, the new way, the new path to looking at the life, and for us to help the people, maybe to someone to get the mobility, someone to come out of the pain, and someone to get the better health. Thank you so much.
Selber. Zumachen, aufmachen. Zumachen, aufmachen.
So, I just put some slides for you. Just a few slides about the nervous system, and then of course a little bit about this here. And this is the drainage of the bone, you know. All the lymphatic system is the drainage of extracellular matrix liquid. Heute ist der zweite Tag zu Ende gegangen und es war wieder sehr inspirierend. Wir hatten Referenten aus England, aus Indien, vor allem wo es darum ging, die Fortschritte in den einzelnen Ländern darzustellen, teilweise ja schon seit 10 Jahren wie in Indien. Und würde man nicht für möglich halten, dass in einem Land, wo man immer sagt, ja, das ist so Subkontinent und alles so arm und so, dass diese Leute A, hoch motiviert sind und B, Ergebnisse erzielen, die spektakulär sind. Ich habe erste Fälle gesehen, die weiteren werden morgen kommen. Also es sind wirklich Fälle, die dann weit hineinreichen, auch in den Bereich der Chirurgie, wo man teilweise Beine bei uns amputieren würde, aber dort durch ja im Prinzip Aktivierung der Mikrozirkulation relativ konsequent, wie es dort gemacht wird, einfach die Wunden zugehen, heilen und man eben dann so Dinge wie Amputationen vermeiden kann. Und jetzt geht es darum, das war auch ein wichtiger Punkt heute Vormittag, dass das immer mehr messbar gemacht wird, dass die einzelnen Fälle gepoolt werden, dass Statistiken erstellt werden, um eben hier tatsächlich zu zeigen, dass hier eine große Evidenz dahinter ist.
We are here for the 22nd International Matrix Rhythm Therapy Workshop. Let's begin the day. I went to Germany, Munich, to Randoll Institute. I took the training over there. Then in 2014, I got my own device and started with the journey of matrix rhythm therapy. I got many opportunities to treat different patients, sports persons, and the variety of patients I see at my clinic is amazing. right from small neck pain, shoulder pain, to immobilization patients. And after that, I would like to present few cases where we have a follow-up of 5 years. Even after stopping the matrix treatment, the X-rays are showing changes, and the changes are maintained for 2 years continuously. So this is the first case. This is called ankylosing spondylitis. I hope everyone is aware. It is a type of arthritis where inflammation of joints is there. Spine is the major portion that is involved, and typically there are changes seen in the pelvis and the hip region. X-rays will always show a bamboo spine, that is the fusion of the vertebrae, and it will be fixed. There is a typical question mark deformity is seen in the spine. Now this 48 years old male came to us. So we started the treatment once a week, and now still after 3 years he is on the maintenance dose. Once in 15 days he comes to the clinic and takes the treatment. Along with the matrix rhythm therapy, we had used some conventional therapies also. So I'll just show you pre and the post treatment changes. You can, maybe there is not much curvature difference, as I said, because the spine is already fused. But if you can note, there is a color change in his skin over here, which we had not expected, or we had not predicted that when we started with the treatment. Even though there was not much change in the X-rays, we could see that his range has improved. Flexibility has improved. Now in this, I would like you all to appreciate that his posture, his belly is automatically showing improvement. And the most important change, that what he was very happy, when he came to the clinic first day, he was not able to lie down without 2 pillows. And now this is he without a single pillow, because now he is able to sleep at anybody's place. Otherwise he was avoiding going to somebody's place because he need to have that typical pillow, typical bed. Now he said that I can lie down wherever I go. He is now very happy to enjoy the trips. So what matrix therapy gave me as a clinician, as an academician, and what difference it made. So when I started writing what are the benefits of matrix that matrix has given me, I could find that from 2013 to this day, money was the thing that was important. But now when I see as a retrospective thing, peace of mind is the first thing, and money now doesn't count anymore. So the direction is more important. I know I have started late, started with a lesser speed, but I am thankful to Randoll sir and also Sandeep. Sandeep, I think that I need not thank you from the dais. But the direction which they both have given me is very important. Thanks a lot. Thank you Seema ma'am, Randoll sir, and all the colleagues and the patients who have helped me. Thanks a lot. Thank you.
Good morning, myself Dr. Shirish Birazda. I am a physiotherapist working in Pune. As Sir mentioned, this is a wonderful journey which started of course from him and Dr. Sandeep, who all the way dragged me in on a train and convinced me about this therapy. This is the journey I started with, of course, Sandeep sir and Anil sir. Without their help and guidance, this was difficult. So this was our initial group where we actually started with matrix. So it is Dr. Randoll who opened our eyes to all those areas, and that is why today's presentation is. When I started, my first interaction with Dr. Randoll was regarding this device, and in initial days I used to think this as another device rather than a concept. So he asked me, what you do for the pain? So I told him, okay, we do IFT, this interferential therapies, ultrasound and all those things. Then his question was, if the already muscle is in spasm, how come a further contraction will cause a relief? It's not possible. You need to relax the muscle. That really shook me to the core. Yeah, this is what the wrong is. We've been taught wrong. It was not a smooth process. It was just release the pain, that's it. Block the pain, not to treat the areas. What he says about the healing, the logistic, derailment, those terms I have to go home and read about them in dictionary. What exactly that means. Synchronization, coherence, that was too much for me to handle. It took me another 3 months and discussion with Sandeep sir to come to his terms what exactly matrix concept is. So to start with, I would like to just tell you the stages. These are important because most of my images will represent one of these images. And the reason I would like to point out one more thing, what we had a discussion was this granulation and angiogenesis. No one taught us what is exactly angiogenesis. It was just a definition in our textbook. It's a formation of new blood vessels. This word was explained to me by Dr. Randoll and Dr. Sandeep sir. When I had a discussion with them, the matrix causes angiogenesis. I said it's not possible. That means you are actually making new cell formations. You are actually making the body to heal, which is difficult to understand, but it was there. But once I started with the cases, this thing I could really see in my patients, and even my patient used to give me the feedback. So we'll start with my first case. This is a case I recently did. He's a 23-year-old male. He is a spastic diplegic. Okay, so and his both of tendo Achilles were operated when he was 3 years old in the year 1999. So it was TA lengthening done when he was 3 years old. In the month of November, he met with a trauma, and at the same site where he was operated 20 years back. So that causes a small wound in that area, and the wound size was initially hardly 1 centimeter. Later on it was almost 4 centimeters. 4 times it opened it up. So this was the case I started. Now in the second image, it is within 7 weeks you can clearly see the changes in the skin color, and the patient told me the pain reduced by almost 50%. Now at the end of the month, first month, we can see the granulation tissue formation. Okay, and the second month it's almost healed. At the end of the January, this thing has completely healed. Now he can walk, he can go on the steps. Everything is normal. All the tests are normal. There is no infection and nothing. I removed the block. Now the body will take care of itself. The angiogenesis. This was one of the earliest cases I have seen and I have done. So, any doubts?
Good morning, everybody. I'm Dr. Leena Oti. I'm a physiotherapist. I have done my graduation from Government Medical College, Nagpur. First time I heard Dr. Randoll sir in 2011 in IIP conference, Pune. And I saw my seniors moving around with a magical wand in their hand. And that time I was really not very much convinced. But in 2012, I have attended Dr. Randoll sir's workshop in Pune, and my journey with matrix started. I think I have attended all the workshops after that. And every time whenever I meet Dr. Randoll sir or any workshop related to matrix, there is always improvement in the understanding. And I am going deeper and deeper in the matrix concept. So I'll come to my topic, effect of matrix rhythm therapy in Parkinson's disease, a case study. 80-year-old patient, male patient, came with the chief complaint of severe scoliosis on right side with neck tilted to right side. He was unable to do neck extension. When he came to me, more than his bend on the right side, his first complaint was, I cannot even finish one glass of water or 1 cup of tea. He came like this. You can see there is severe bend on his right side. He cannot even look fully up. He cannot do neck extension. I said, we'll start with MaRhyThe. So I covered following areas. I treated paraspinally. I treated cervical region more on the right side. Immediately after first session of MaRhyThe rhythm therapy, he could finish a full glass of water without drooling of water. And this produced a very positive attitude in him. Patient came to me for the second session. His chief complaint was gathering of abdominal structures on right side due to pain on the right side of abdomen while walking. And this was the change after the second session. You can see how much his posture has changed. See, this is before and after. There is lot of difference in his curvature. And after this, the patient was advised for proper nutritional diet. He was advised to improve his water intake. His neck extension improved. His breathing had improved. Lumbar extension had improved. His walking speed had improved. His oral intake was improved. Patient then continued MaRhyThe rhythm therapy on a regular basis. The rhythm of body, the melody of mind, and the harmony of the soul creates the symphony of life. This was told by Yogacharya B.K.S. Iyengar. And I thank you, sir. I thank you, Sandeep sir and Anil sir, for always mentoring us. And I thank you, Dr. Mustafa sir, for giving us the opportunity to share experiences with you all. Thank you very much.
A very good afternoon to all of you. It's afternoon now. This is Dr. Danish, and I think an elaborated introduction of me has given by Anil sir. So today my topic is, this is a case study, the effect of MaRhyThe rhythm therapy in hypothermia. So hypothermia is a condition when your body temperature goes down than the normal body temperature. So this is a case study of a 71-year-old male gentleman. So he came to us with complaints of shoulder pain. When we talked to the patient gave us the history that once he came to his hometown, means my hometown, and it was a cold day. Before around 29 years, in 1990. So it was a cold day. After that, he got this problem. Patient was not irritated frequently. He was well balanced. But he feels his hands and feet often cold. Actually, this is the indication for us that this could be a case of hypothermia. We have some other symptoms also. Now what changes happens in cellular physiology are so these are some changes which can happen in hypothermia. In hypothermia, at cellular level, ill-regulation of the body fluid occurs. That leads to electrolyte imbalance. So what, the protein and tissue fluid will not return into the blood, and protein and tissue fluid plays an important role to maintain the temperature of the cell. We gave the first session of the matrix to the patient. Shoulder pain was significantly reduced, and after 2-3 days when patient came to the clinic, the patient gave us the feedback that he felt some hot. Then our confidence got boosted, so we thought that we can work on his hypothermia also. Then we increased his number of sessions for matrix rhythm therapy, and after 6 sessions of matrix rhythm therapy, this is the result. So now the result, body temperature increased more than 2 degrees and become normal body temperature, that is 98.6 degrees of Fahrenheit. Patient is feeling feeling 80% better from his previous condition, and he feels miraculous increment in physical and mental energy. Pain and ROM of patient, ROM of shoulder is fully recovered, and patient is still under treatment of us on off and on basis for maintenance. Case is purely for the matrix. Why so? Because the disturbance which are occurring in the cell in hypothermia are exactly opposite to the normal cell. So dry needling is a targeted approach for the muscles to break the tender points, to break the nodules and all. That is not holistic. Even laser is not a holistic approach, targeted approach, and matrix, due to its holistic approach, was the perfect modality for this case, or we can say perfect concept for this case. Thank you, sir.
Heute war der Tag der indischen Delegation, die eben ja unglaublich interessant die einzelnen Fälle präsentiert hat aus verschiedensten Fachdisziplinen. Offene Wunden, diabetische Ulcerationen, venöse Insuffizienzen, die zu offenen Beinen geführt haben. All das wurde systemisch letztendlich angegangen. Das heißt einmal Systemtherapie, lymphatisches System, venöses System, aber auch dann Grenzstrang und dann eben zum lokalen Fokus hin. Also interessant, wie die Inder die Idee, diese systemische Therapie letztendlich hier begriffen haben, den Systemansatz, dass man eben immer wieder vom Allgemeinen zum Speziellen kommt und nicht nur am lokalen Symptom rumdoktert sozusagen. Durch dieses Prozessmanagement auf Zellebene sind eben teilweise Wunden zugegangen. Das hat man nicht für möglich gehalten, auch ich selbst nicht. Es zeigt einfach, dass letztendlich Heilung immer wieder bedeutet, die Systeme anzukurbeln, von innen heraus Blockaden zu nehmen, egal auf welcher Ebene, physikalisch, chemisch. Letztendlich muss der Metabolismus angekurbelt werden und dann wissen die Zellen vor Ort, was sie zu tun haben. Und das ist schon beeindruckend, die Fälle, die hier gezeigt worden sind. Wir werden heute Abend sicher noch zusammensitzen und das eine oder andere vertiefen und morgen dann wieder ganz optimistisch und freudig in den nächsten Tag gehen.
I'm a physiotherapist and osteopath, and I got to know the matrix rhythm therapy concept in 2006. It was at a Congress for dentists. Then I visited the workshop 2006 in October in Italy, Ischia, and since then this concept is very present in my daily life. We have a lot of chronic pain patients, and I must say that I'm very glad for having this concept, this machine helping me, because the results are getting much faster, much better, and they stay longer. That's the benefit of it. So, talking about stress, we have to think about what is bringing on the stress, and in our days it's a lot of chronic diseases which make really stress because of the pain which is going along with the chronic diseases, but also operations and psychology states like fear, like anger, like pain. We have to talk about problems in the working world. We have 25% basic stress level, which is normal in our dealing with the environmental surrounding, but most of the stress we have is coming from the working world. If you have stress, you can influence over the sympathetic nervous system directly the skeletal muscle system, and it can cause pain because we have contraction also. If you have a contraction in this muscle, then we have a compression of the small vessels, the blood vessels in this area. So this makes a nociceptive stress and causes pain. So the sympathetic nervous system can directly influence the muscle system and can cause muscle pain. There are a lot of junctions between the emotional system and the stomatognatic system. And if you look at the homunculus, then you see that we have a huge amount. It's over 1/3 of the homunculus where the representation of the orofacial tract is present. So all these afferent input which we get from the stomatognatic system is coming inside here, and if we have too much activity from this area, we have definitely changes in the motoric system. And it's known that in most of the times, like a traumatic experience and emotional stress really is affecting the jaw muscles. These are all the symptoms which can develop in these dysfunction type. Biopsychological studies show that the most stressors really appear in the working world. Most of the times it's the less positive feedback from colleague and chef and a negative social surrounding in where you work. This has significant increase in prevalence for musculoskeletal diseases. So stress, where we cannot avoid stress, but this creates in the amygdala also an increase of serotonin. And the serotonin metabolism is known as being connected with emotions of fear and depression. But the good thing is you can change your behavioral, how you get along with stress, even if you had traumatic experiences and you had neuroplasticity change in your brain. We can, with the so-called talking medicine, really can change our feelings, our thoughts, our mind, and we can affect the neural networking of our brain. So the main thing is, and the main message for you, the take-home message, is that change your mind and you change your brain. So if you are in a helpless situation, don't give up, never give up. Always think that there is an exit somehow, somewhere. Have a good day and thank you for your concentration.
I am Dr. Harish Kumar. I am a physiotherapist and ergonomist. I am from South India. My success story is what I am going to discuss here is Hashimoto's encephalopathy, temporomandibular joint dysfunction, Guillain-Barré syndrome and tics disorder. A small short about Hashimoto's encephalopathy. It's a rare disease. It is an autoimmune thyroid disease under underactive hypothyroidism. It's renamed to steroid responsive encephalopathy associated with autoimmune thyroiditis. Its prevalences mean 2.1 people in 1 lakh person, and women are more likely to be affected than the men. So what all the symptoms for Hashimoto's encephalopathy? Disorientation, tremors, concentration and memory problems, psychosis and delusion behavior, spasm, so myoclonus, a jerk in the muscles, lack of muscle coordination which leads to difficulty in walking, speech problem, behavioral changes and personality changes. What I have said here, everything was there in my patient, which I am going to show you now. The history of the patient: she is a 64 years old lady. She is a duration in the hospital for medical help for 5 months, and she is a strong diabetic lady for past 20 years and the thyroid dysfunction for 20 years. And the problem was a sudden onset for her. Patient was unconscious and in ICU, intensive care unit, for 4 months for observation. I am going to show you a video. This is the first video when I entered into the patient. This is the condition of the patient. This is the first day video. Her daughter is calling her. She is asking, who am I? She is not able to respond to this. The video I am going to show after matrix. I have given 60 minutes of session for them. I will show you what happened next. I am asking her to open her eyes. I am asking her to open her eyes, open and close. She is doing it. I am asking her to smile. She is smiling it. This was immediately, I'm asking her to show her tongue. She's showing it. This happens immediately after 1 hour of matrix session. After seeing this result, I said, yes, I'm in line with it. Then I started working on with matrix for next sessions. Now the patient doesn't have any wounds. The patient is so comfortable without the wounds. All the wounds have been healed off. This is after 5 sessions. The patient started to move her limb. Before it was, there is no movements. We have to lift it. The first day when I positioned the patient, I lifted it. The next, on the 5th sessions, the patient started to move her limbs. I am asking her to say the numbers. She is saying 1, 2, 3. I ask her to say. She is saying it. Day 10. 10 sessions. The patient is sitting like this in the wheelchair. She started to having her food by herself. We keep it on a table. She will eat it and everything. The successful thing is, 2 days back, my junior has called me and said that we have made the patient to walk with the walker. I said, where is the video? Where is the video? Because I need records. I said, where is the video? I said, so the next case, success story. So my spectrum of practice for physiotherapy is going bigger now, because only joints and structures where we are doing it, no, there are places where I can explore. I'm exploring it. So thanks to Randoll sir for this wonderful scope to increase it, sir.
Good afternoon to you all. Respected Dr. Randoll sir, Mr. Anil Deshpande, Dr. Sandeep Bhagwat, and my Matrix family. I am having a Ayush Rehabilitation Institute where we combine the Ayurveda, Yoga, Siddha along with the Matrix. Because of this combination, we ensure for the optimal development of the healthy life. I am going to represent the case on non-healing wound in a failed graft surgery. This is actually the case. The 50 years male patient, by profession a teacher and a chain smoker, coming from a middle class family, came to my hospital with chief complaint of non-healing wound since 1.5 years. He got operated for femoral distal bypass of right popliteal artery and skin grafting has been done on non-healing wound. But the graft was rejected and again he suffered from non-healing wound. This is the case when he represented with me for the first time. When he represented to me for the first time, see how extensive this wound is. There is considerable loss of the tissue. Edges are not coming together. This is the photograph after doing the matrix. After 2 months I have taken this photograph. This is the photograph after 5th month and this is after 7th month. The matrix rhythm therapy weekly twice for 8 weeks. Then further 4 months I have given matrix for only once in a week. And some Ayurvedic treatments I have followed. This is another case of non-healing wound. She is a female lady. Age is 22. She was pregnant. At that time, a thorn pricked into her heel as she was working in a farm. She got operated and the thorn was removed. But till then, the infection has reached to her calculi bone. At the time of surgery, they have scrapped some little calculi bone, but this wound was not healing. I did matrix for her weekly thrice, and now this is the case. But this case also took nearly about 1 year. Thank you. Thank you to you. And also thanks to my extended family who supported me being here this afternoon. Thank you. Thank you to you.
Heute verging der Tag wie im Flug. Was anstand, war der Bereich CMD, Kraniomandibuläre Disorders. Und da hatten wir einen sehr interessanten Vortrag von Frau Nuttmann. Als zweiter Teil des heutigen Tages kam natürlich dann noch ein weiterer Beitrag aus Indien. Das war auch wieder hochinteressant. Und zwar ging es einmal um einen chirurgischen Fall, wo man nicht für möglich gehalten hat, dass eben nach einer Lappenplastik am Fuß und einer Gefäßplastik am Fuß, wo letztendlich alles im Desaster geendet hat. Beides hat nicht funktioniert. Es war eine große offene Wunde, eine gangrenöse Wunde erst, die dann letztendlich durch sukzessives Aktivieren der Mikrozirkulation wie durch ein Wunder zugeheilt ist. Also sowas hält man nicht für möglich. Ich hätte es nie gedacht, dass man mit dieser Methodik hier diese Ergebnisse erzielt, aber es zeigt mir persönlich mal wieder, dass wir eben hier einfach ein Prozessmanagement machen auf Zellebene, hier die Blockaden lösen und am Schluss die Selbstheilung stattfindet. Und es gibt eben nur die Selbstheilung, damit müssen wir uns alle abfinden. So wird es sein, wir können immer nur die Rahmenbedingungen optimieren und das sind eindrückliche Fälle, die so überzeugend sind, dass sie am Schluss keiner glaubt.
I'm a medical doctor. I'm educated from Ege University Medical School in 1987. I worked in many clubs in Turkey, particularly in the Super League. And the last 2.5 years, I have been in Turkish Football Federation national age groups. This is my team when we were going to Mediterranean Games. When we approach to injured athlete, we must combat two topics. One, combat with the re-injury anxiety. It's very, very, very important because the athlete never want to go back to pitch. He wants to stay with you more and more. The second topic is support reaching previous performance level. So, the quality of healing matters. It's important. We must suppose a quality healing process to athlete. I want to present a youth football player. He is playing in Göztepe football team, under 14 years old team player. He came to me with chronic groin and pubic pain, particularly when kicking the long ball and sprinting. Failure in performance. Performance is going down day by day. We get the clearance from the general surgeon about the athletic hernia, and it's not related with the hernia, he said. Matrix rhythm therapy, we applied 5 times 60 minutes, full body, pelvic girdle and groin, and we applied some medical fitness, especially involving the back and the oblique parts of the body. I want to give more detail about this. It's coming from the middle. Look, coming, sprinting, and making the goal. In our field, this is the prediction of the success. If you can take the athlete to the field and you can make him play again, then it's success. If you make therapy, if he cannot go back to the pitch, then it's nothing. The other topic I want to talk about is recovery. Matrix rhythm therapy, the usage in recovery. Now I invited a Hercules to here. He is power lifter. He became champion, and I want to invite him to here. John.
And my last championship was 1.5 months ago, and after that normally I have too much pain on my back. After that I came to my doctor Mutlu Gürsoy, and we started using matrix therapy, and I felt the first time in my life I felt a very fast recovering. Maybe in the first time we applied, 50% of my pain was gone. Thank you.
Now I want to say something about matrix rhythm therapy in my view. Why I like it? I like it because I just think like Leonardo. Simplicity is the ultimate sophistication. And Einstein says everything should be made as simple as possible, but not simpler. And matrix gives us this deepness. And I can say in my professional life, I saw that many years matrix is present in the life. It's very important. And this is reliability, and scientifically it's very important. And for the sports area, validity is very important, and validity is maybe more important than the reliability. But if something is valid, then it must be reliable, you know. In this way, I went to Munich and passed from the bridge that my Indian friends passed. And we went to Hard Rock Cafe, Munich. Then we went to Ulrich, and he gave us too much. Thank you.
Sarve bhadrani pashyantu ma kaschit dukkha bhag bhavet.
With this prayer, I begin. A very good morning to you all. Respected Dr. Randoll, Mrs. Randoll, my dear Matrix family members. It has really been a wonderful journey of last 10 years. And I would like to show you some of the best cases that I have done in the last years. Matrix is the main core of my practice in my town. I would like to tell you the story behind this case. This is a 25 years old female with decubitus stage 4 ulcer coming to us. Because when I went home back in 2009, I discussed this case with my orthopedic surgeon, and he said, you have a new tool for microcirculation, and can you just improve the microcirculation? We want to put a graft for this patient in the next week. We just did a session from the hamstrings, back of the knee, calf, and I just waited for things to happen. Next week, the patient showed granulation, and you can see in 3 weeks, the ulcer showed signs of healing. We followed up the case. The surgeon had to cancel the surgery. This is the healing. This is what we could see with our naked eyes. We didn't need a microscope to see whether really there is a microcirculation improving in the tissue or not. And then that really convinced me for whole of my life. This is the best tool that I have for the profession. Continuing our journey with ulcers. From ulcers to sports rehabilitation. She is Rutika Sriram. She is a diving champion of the country. She is 22 years old and a professional diver. She has to practice 100 dives at least in a day at the Commonwealth Games in 2010 in Delhi. She had a right shoulder pain during one of her practice sessions after the Commonwealth Games. We did the whole spine paraspinally, starting from the cervical spine down to the trapezius, parascapular, paravertebral down. The deltoid capillary dyskinesia has improved. This was not with mobilization or manipulation at all. This was with only matrix rhythm therapy. And then we started adding the rehabilitation program. Once we achieved, we prepared the tissue for exercises. You see the range of motion? This is what she needs. Imagine a sports person, sports individual out of the game for 2 years, a high professional athlete going pillar to post to get rid of the pain, and the rescuer is matrix rhythm therapy. She won the gold medal. Again, after rehabilitation, she set new records for herself. She broke all her previous records which she had set, and the credit goes to matrix rhythm therapy. I owe my work to Dr. Randoll, and she owes this case to Dr. Randoll. She was awarded the Chhatrapati Puraskar by the state government, and she has dedicated the award to Dr. Randoll. Why did it all happen? The osteogenesis, the osteolysis, the restricted movements, this is because there was tuning of the physiology. It is a basic approach that we have to target. If you can target the microscopy, the macroscopy follows. So I always tell my wife not to apply talcum powder. Instead, improve the microcirculation of your face by therapies like this, instead of doing a talcum powder or a makeup. It should come from within. The facial glow should be from within, not by just applying. It's just like physical therapy. You apply something from top, but it should come from within. This is a basic approach that I have understood in all those 10 years. The cell has to dance. The rhythm has to come back again. Just do it. Don't worry. Just do it. Life is simple. We complicate it. I would add, don't complicate it. Thank you for your patient listening.
Heute Vormittag waren interessante Vorträge, und zwar gab es einen Beitrag aus der Türkei über die Sportmedizin, und das ist spannend, wie hier im Bereich des Fußballs, aber auch bei professionellen Gewichthebern, teilweise auch bei Weltmeistern. Der eine Weltmeister war sogar hier anwesend und hat eben berichtet über die entsprechenden Vorteile, die er hat, Schmerzbeseitigung durch die Rhythmustherapie. Und dann gab es noch andere tolle Highlights aus dem Sportbereich, diesen Morgen aus der Türkei. Was mich am meisten aber fasziniert hat, es war eben wieder ein Beitrag aus Indien. In Indien bin ich ja etwa seit 10 Jahren tätig und bin mit Sicherheit mindestens einmal pro Jahr in Indien, um dort eben die Therapie in die Verbreitung zu bringen. Und was mich hier am meisten freut, ist eben, dass nicht nur die Therapie von den Ergebnissen unglaublich toll sind, sondern dass vor allem die Philosophie verstanden worden ist in Indien, dass die Philosophie in Indien verstanden worden ist. Das heißt, das ganze Thema Kohärenz, nichtlineare Thermodynamik, Nichtgleichgewichtsthermodynamik Und das ganze Thema der Synchronisation des Körpers über externe Frequenzen, was eigentlich sehr theoretisch ist, kommt aus der Physik letztendlich heraus und kommt dort natürlich sehr gut auf den Boden des Sanskrit bzw. der ganzen Philosophie in diesem Lande und wird eben hier transportiert von den Therapeuten. Die bringen es 1:1, so wie sie es verstanden haben, aus den Vorträgen. Das heißt, meine Worte aus deren Mund, das ist natürlich für mich das Highlight und dann die Ergebnisse. Schöner kann es nicht sein. Das heißt, hier wachsen wirklich diese Gedankengänge einschließlich der Ergebnisse in bester Form. Das freut mich unheimlich.
This is now, you will have a special place in my clinic.
This is called as Gajanta Lakshmi. Gaja means elephant and Lakshmi, that is prosperity.
I just read the Hindu idol of prosperity and happiness